And I wish I would have done that from the get-go, not just maybe in the last couple of years.
Is there anything you recently learned about protecting your well-being that you wish you had learned it sooner?
Yeah, I think that is actually a very good question. And I think it really took having a child and needing to really figure out where I needed to prioritize my time to help me learn that no is a one-word sentence. That's like the joking thing they say. But you don't need to justify your no. Everyone feels like you should, right? Because we're people pleasers in medicine. We want to help our patients. We want to help our colleagues. But sometimes you just have to decline things. And I've now implemented a policy with myself where if I get asked to do something, I don't reply for 24 hours. And I think about it. And I think about, will I be away from my child? Am I going to have to cancel clinic in a way that's going to put more stress on me? What are the benefits and what are the downsides to doing this? Is this something I'm really passionate about? I recently took over doing a committee at the American Academy of Ophthalmology because it's something I think is important. Getting preferred practice guidelines out for the Conference of Ophthalmologists on uveitis will help everyone, right? It's going to take some travel though, so I'm away from my family. But I also say no to things now. I used to do a lot more journal article reviews, and now I don't say yes to all of those. I say yes if it's interesting or if I feel like I'm submitting papers and should put some back into the review process. But I don't say yes to everything as much as I used to. And it's hard because you feel a little guilt saying no sometimes, especially if it's a colleague asking you. But you have to set up some boundaries, and everyone's are going to be different about what is your value system. And then you need to actually adhere to it. You can allow yourself the occasional exception, but for me, that 24-hour stop, thinking about what are the pluses and minuses, and then answering after I've given it the thought versus the knee-jerk yes, has actually been a really big plus in my life. And I wish I would have done that from the get-go, not just maybe in the last couple of years.